I want you to think about something for just a moment. Right now, as you watch this video, there is a gland inside your body the size of a walnut that is quietly determining the quality of every single day you have left. Your sleep, your energy, your confidence in the bathroom, your ability to feel like a man who is still fully alive. And the question I am about to answer, the one in the title of this video, is not just about a private habit. It is about whether that gland is being protected or slowly destroyed. And the answer, when you hear the real science behind it, is going to surprise you in ways you did not expect. I'm Dr. Hana, a urologist with over 30 years of experience helping men like you regain their energy, performance, and vitality. If you're new here, welcome to the channel. Before we go any further, if you're serious about protecting your prostate, staying strong, and living without fear, hit that subscribe button and turn on notifications. I share real information backed by real science for men just like you. And if this topic matters to you, type 1 in the comments and tell me where in the world you're watching from. If not, type 0 so I know how to help you better next time. Now let's get into it. Before we go anywhere, I need to say something directly. This video is not about shame. It is not about judgment. It is not about making you uncomfortable with a topic that already carries more silence and embarrassment than it deserves. This is a medical conversation, a real one. The kind that most men over 60 have never had with a doctor, not because the information does not exist, but because nobody took the time to sit down and give it to them straight. I have been practicing urology for 30 years. I have sat across from thousands of men, good men, strong men, men who built families and careers and lives, who came into my clinic quietly carrying questions they had never said out loud to anyone. Questions exactly like the one in the title of this video. And almost every single one of them left that conversation saying the same thing. They said, "Why did nobody ever tell me this before?" Today, I am telling you all of it. Let me start by painting you a picture. His name was Raymond. He was 66 years old, a former high school football coach, still broad across the shoulders, still sharp. He came into my clinic on a Tuesday morning and sat down in the chair across from me with the careful stillness of a man who had practiced looking calm. And then he said, "Dr. Mori, I have not slept through the night in 8 months. I wake up at 1, then at 3, sometimes at 5. The flow is weak. It takes forever to start. And I am scared, not of the symptoms. I am scared of what they mean." Raymond was not broken. His heart was strong. His blood work was reasonable for his age, but something inside him was changing, and he could feel it without being able to name it. What he was experiencing, and what millions of men over 60 are experiencing right now in silence, was the beginning of a prostate in distress. And here is the part that Raymond did not know, the part I want you to carry with you through every minute of this video. The daily habits he had never thought twice about, including the private ones, were playing a direct and measurable role in what was happening inside that gland. So let us start at the very beginning. Part 1. What your prostate actually does, and why it starts demanding your attention after 60. Most men spend the first 60 years of their life never thinking about their prostate once, and that is actually a sign that it is doing its job. Because a healthy prostate is a quiet prostate. It works in the background, producing the fluid that carries and nourishes sperm during ejaculation, maintaining the delicate hormonal environment of the male reproductive system, and supporting the smooth function of your urinary tract. When it is healthy, you do not feel it. You do not notice it. It simply does what it was built to do. But here is what changes. From your late 30s onward, your prostate begins to grow. Slowly at first, almost imperceptibly, but by the time you reach 60, that growth has become significant enough that most men are already feeling its effects. even if they have not connected what they feel to what is happening in that gland. The prostate sits just below your bladder, wrapped around the urethra, which is the tube your urine travels through on its way out of your body. As the prostate grows, it begins to compress that tube, not all at once, not dramatically, but gradually, the way a slow tide reshapes a shoreline. And what you feel is exactly what you would expect when that compression begins. The stream becomes weaker, starting takes longer, the feeling of complete emptying becomes harder to achieve. The nighttime trips to the bathroom increase, 1, then 2, then 3 times a night, stealing your sleep and your energy in a way that compounds over months and years into a fatigue that feels like something much bigger than a plumbing problem. Raymond recognized every single one of those descriptions. He nodded through each one, and then he asked me the question that most men are afraid to ask out loud. He said, "Dr. Mori, is this just aging? Is this just what happens? Am I just supposed to accept it?" And I told him what I am about to tell you. No, these changes are real, but you are not a passive observer of what happens inside your own body. You have far more influence over this than anyone has probably ever told you. And the most powerful proof of that influence begins with understanding what the science actually says about a question most urologists never bring up with their patients. Part 2. The real science behind ejaculation and your prostate. What actually happens to the prostate of a man who masturbates every day? What does frequent ejaculation, whether through self-pleasure or with a partner, do to the prostate gland over time? Is it harmful? Is it neutral? Or is the answer something far more interesting than most men ever imagined? Let me take you directly to the research. A landmark study published in the European Urology Journal tracked tens of thousands of men across a period of nearly 18 years. This was not a small pilot study. This was rigorous, long-term, large-scale research. And the findings were striking enough that when I have shared them with patients in my clinic, the reaction is almost always the same kind of quiet, wide-eyed surprise that Raymond showed me when I told him. Men who ejaculated more frequently, specifically those who averaged 21 or more times per month, had a significantly lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. Not marginally lower, significantly lower, and the association held up across multiple adjustments for age, lifestyle, and health status. Let that sit for a moment. Now, I want to be very careful here because I do not want you to walk away with a misunderstanding that does more harm than good. Frequent ejaculation is not a cure for prostate disease. It is not a guarantee of protection. It is not a replacement for medical care, proper nutrition, regular movement, or annual screening. It is one piece, one important and often overlooked piece of a much larger picture. But the biological reason behind that association is something every man over 60 deserves to understand. Researchers call it the prostate flushing hypothesis. And here is how it works. Every time a man ejaculates, the prostate gland contracts and expels the fluid it has been producing and storing. That contraction is not just a reproductive event, it is a maintenance event. It clears out old cellular material, accumulated metabolic waste, and potentially harmful substances that can build up inside the gland when it sits in a state of prolonged stagnation. Think of your prostate the way you think of a water system. If water flows through pipes regularly, those pipes stay clean and functional. But if water sits still inside a pipe for weeks or months, things begin to accumulate. Sediment builds, the walls narrow, the flow becomes compromised. Your prostate operates on the same biological principle. Regular flushing through ejaculation keeps the internal environment of that gland cleaner, more active, and less hospitable to the kind of cellular stagnation that creates long-term risk. Raymond sat quietly for a moment after I explained this, and then he looked at me and said, "So you are telling me that something I thought might be hurting me has actually been helping me all along?" And I said, "Raymond, the habit itself was never the problem. What matters is understanding the full context around it. And that full context is what we are going to cover right now." Part 3. The 3 major changes happening inside your prostate after 60. Even with regular ejaculation supporting the flushing mechanism, your prostate is facing 3 significant biological challenges after 60. Understanding all 3 is not optional. It is essential. And the third one is the one that most doctors move through too quickly, so I am going to give it to you completely and without softening. Change number 1. Benign prostatic hyperplasia, or BPH. This is the medical name for prostate enlargement that is not caused by cancer. The word benign matters enormously here. BPH is not a malignancy. It is not a death sentence. But it is extraordinarily common, and its impact on quality of life is real and often severe. By age 60, more than half of all men have some measurable degree of BPH. By age 70, that number climbs past 70%. By 80, it approaches 90%. So if you are in this video's target audience and you are experiencing urinary symptoms, you are not an outlier. You are in the majority. And that majority deserves real information and real solutions, not just a resigned shrug from a doctor who tells you this is simply what happens when you get older. BPH is manageable. Its symptoms can be significantly reduced with the right combination of lifestyle intervention, nutritional support, targeted exercise, and where appropriate, medical treatment. The key word is manageable, but only if you engage with it. Only if you stop waiting for it to resolve on its own, because it will not. Change number 2, the DHT shift and hormonal imbalance. Here is the hormonal conversation that most doctors have too briefly, and most men leave not fully understanding. As you age, your testosterone levels naturally decline. Most men over 60 are aware of this in a general way. What far fewer men understand is what happens to some of that declining testosterone. A portion of it, influenced by an enzyme called 5-alpha reductase, is converted by the body into a significantly more potent androgenic hormone called dihydrotestosterone, or DHT. And DHT has a very specific and very direct relationship with your prostate. DHT actively binds to receptors in prostate tissue and stimulates those cells to divide and multiply. The higher your DHT levels relative to your overall hormonal balance, the more aggressively your prostate tends to grow. DHT accumulation is one of the primary hormonal drivers of both BPH and increased prostate cancer risk. This is why the conversation about your hormonal health after 60 is not just about libido or energy. It is about the physical size and cellular behavior of your prostate. And it is a conversation worth having with your doctor specifically and in detail. Change number 3, cellular vulnerability and the reality of cancer risk. I promise to give this to you directly, so here it is. Every single day, your body replaces aging cells with new ones through a process of continuous cell division. This is normal. This is how your body sustains itself. But across decades, across billions of individual cell divisions, the probability of a replication error increases. A single cell copies incorrectly. That cell divides. And under the right conditions, in an environment of chronic inflammation, hormonal imbalance, and accumulated oxidative stress, those errors can become something serious. Prostate cancer is one of the most commonly diagnosed cancers in men over 60 worldwide, and the most frightening thing about it is not its prevalence. The most frightening thing is how quietly it develops. Many men with early-stage prostate cancer have no symptoms at all. None. Not a single sign that anything is wrong. Which is exactly why what I am about to say is not a suggestion. It is a clinical directive. Annual prostate screening after 60 is not optional. It is essential. A PSA blood test and a digital rectal examination are the 2 tools that give your doctor the ability to catch changes in your prostate before they become irreversible. Early-stage prostate cancer has extraordinary treatment outcomes. Late-stage prostate cancer caught after years of avoided screenings is a very different conversation. I have had that very different conversation with men in my clinic. I do not want to have it with you. Now, before I take you into the lifestyle factors and the action plan that can change the trajectory of everything we have just discussed, I need to pause. If you have stayed with me this far, if you are finding this conversation valuable, if you feel like you are finally getting the honest, clear, science-grounded information that nobody else has taken the time to give you, please subscribe to this channel right now. Hit that button, turn on notifications, because every single week I bring you exactly this kind of content. Real clinical knowledge, real mechanisms, real strategies, no shame and no confusion. You deserve to have this in your life every week, and it costs you nothing to make sure you never miss it. Now, the part of this video that can actually change what happens inside your prostate starting today. Part 4. The 4 lifestyle forces that determine your prostate's future. Understanding your prostate is only half the picture. The other half is understanding what your daily habits are doing to it, for better or for worse. And there are 4 forces at work in the life of almost every man over 60 that are either protecting the prostate or accelerating its deterioration. Let us name them clearly. Force number 1, chronic inflammation. Inflammation is your body's natural and necessary response to injury and threat. Short-term inflammation is protective. But chronic, low-grade inflammation, the kind that builds slowly over years from a diet high in processed foods, red meat, refined sugar, and fried foods, is one of the most destructive forces your prostate will ever face. Your prostate does not sit in isolation inside your body. It is bathed in the same biological environment as every other organ and gland. When that environment is chronically inflamed, prostate tissue becomes irritated, cells divide faster, and the conditions for abnormal cellular growth become far more favorable. Inflammation does not just worsen BPH. It accelerates the cellular vulnerability that underlies cancer risk. Here is what I want you to add to your diet starting this week. Cooked tomatoes, tomato sauce, tomato paste, tomato soup. Tomatoes are one of the richest natural sources of lycopene, a powerful antioxidant that has been shown in multiple peer-reviewed studies to have a directly protective effect on prostate tissue. And the detail most people miss is this. Lycopene is significantly more bioavailable when the tomato is cooked. Eating raw tomatoes is good. Eating them cooked is genuinely better for your prostate. That single piece of information, the cooking detail, is one of the most actionable things I can give you today. Add pomegranate, add berries, add broccoli and other cruciferous vegetables. Add fatty fish rich in omega-3 fatty acids. These are not wellness trends. They are foods with peer-reviewed evidence behind their role in prostate health. And reduce the foods that sustain the inflammatory cycle. Red meat eaten daily, processed foods, refined sugar, fried foods, not as moral judgments, as biological realities. Force number 2, physical inactivity. I see this pattern in my clinic constantly. A man over 60 who was once active, who played sport, who moved through his days with physical confidence, who has gradually, almost imperceptibly, become sedentary. A knee that aches, a back that tightens, a schedule that became more about sitting, and over months and years, movement all but disappears. This matters profoundly for your prostate. Regular physical activity regulates the testosterone to DHT balance we discussed earlier. It reduces systemic inflammation. It improves circulation to the pelvic region, which directly supports prostate tissue health. And it maintains a healthy body weight, which is independently correlated with lower prostate cancer risk. I had a patient named George, 68 years old, a retired accountant who had been sedentary for nearly 4 years when he came to see me. His urinary symptoms were significant. His PSA had been trending upward. We did not start with medication. We started with 30 minutes of brisk walking 6 days a week and twice weekly resistance training. Within 3 months, his symptoms had measurably improved and his inflammatory markers had dropped. You do not need to become an athlete. You need to become consistent. 30 minutes of brisk walking most days of the week is real medicine for your prostate. Add light resistance training twice a week, and you are giving your body a biological advantage that no pill can fully replicate. And one more thing, Kegel exercises. Most men associate these with women's health. They should not. Kegel exercises strengthen the pelvic floor muscles that directly support bladder function, urinary control, and prostate health. They are simple, completely discreet, and you can do them anywhere. Contract the same muscles you would use to stop the flow of urine, hold for 5 seconds, release slowly, and repeat 10 times. Do that 3 times daily, consistently. The results in urinary control and pelvic health are real. Force number 3, dehydration. This one is so simple that most men dismiss it, and that dismissal is costing them. When you are chronically underhydrated, your urine becomes concentrated. Concentrated urine is chemically more irritating to the bladder wall and to the prostate tissue that surrounds the urethra. It increases your risk of urinary tract infections, and critically, it reduces your body's capacity to flush metabolic waste from the urinary system, which is the same biological flushing principle we discussed in the context of ejaculation. 2 to 3 liters of plain water daily. Not coffee counted as water, not tea counted as water. Plain water. It is the most overlooked and most accessible intervention for urinary and prostate health that exists, and most men over 60 are not getting close to that amount. Force number 4. Avoidance. This is the force I feel most strongly about, and it is the one I want to speak to you about not just as a clinician, but as someone who has watched what avoidance costs men over a long career. Men of your generation were shaped by a culture that equated strength with silence. You push through discomfort. You do not complain. You handle things privately. You wait until something is visibly, obviously, undeniably wrong before you ask for help. I understand that. I genuinely respect the resilience behind it. But when it comes to your prostate, avoidance is not strength. Avoidance is a wager you are placing with your life. And the odds are not in your favor. Prostate cancer caught early is among the most treatable cancers in existence. The outcomes for men who screen regularly and catch changes early are genuinely remarkable. But prostate cancer caught after years of avoided appointments, minimized symptoms, and dismissed warning signs is a completely different clinical reality. I want you to make one commitment before you finish watching this video. Book the appointment. Make the call. Schedule the screening, not next month, this week. Part 5, your 4-pillar prostate protection plan. Let me bring everything together into a clear, actionable framework that you can begin implementing immediately. Pillar 1, annual screening without exception. From age 60 onward, annual prostate screening is non-negotiable. A PSA blood test and a digital rectal examination are the 2 tools that give you and your doctor the information needed to catch changes before they become crises. The digital examination takes 15 seconds. 15 seconds that could detect something early enough to save your life. Let no discomfort, no embarrassment, and no misplaced stoicism stand between you and that 15 seconds. Pillar 2, anti-inflammatory nutrition daily. Build your daily eating around foods that actively protect prostate tissue. Cooked tomatoes for lycopene, berries and pomegranate for antioxidants and arterial health, cruciferous vegetables for cellular protection, fatty fish for omega-3 anti-inflammatory support, avocado for healthy fats and potassium, reduce red meat, refined sugar, processed and fried foods. This is not a diet. It is a biological strategy. Pillar 3, movement and pelvic floor activation. 30 minutes of brisk walking most days, twice weekly light resistance training, daily Kegel exercises. These 3 habits together regulate your hormonal balance, reduce systemic inflammation, improve pelvic circulation, and support both bladder and prostate function in ways that compound powerfully over months and years. Pillar 4, hydration and regular sexual activity, 2 to 3 liters of water daily, and maintain a regular, healthy sexual life appropriate to your age and well-being, whether with a partner or through self-pleasure. Both habits support the biological flushing mechanisms that keep your prostate tissue cleaner, more active, and less vulnerable to the stagnation that creates long-term risk. This is not lifestyle advice. This is clinical guidance backed by long-term research. I want to close this video by speaking to you the way I speak to the men in my clinic at the end of a long and honest conversation. Raymond came back to see me 4 months after that first appointment. He had changed his diet. He had started walking every morning. He had made the small but consistent adjustments we discussed. And he sat down across from me and he said, "Dr. Mori, I slept 7 hours last night, straight through." He was not looking for praise. He was simply telling me that something had shifted, that the body he had started to feel was leaving him had come back, at least partly, because he had decided to pay attention to it. That decision is available to you, right now, today. Not because your situation is hopeless and you need rescuing, but because your body has been asking for a different kind of attention, and you now have enough information to give it exactly that. Your prostate is not a verdict. It is a gland that responds to what you feed it, how you move, how you hydrate, and how willing you are to show up for yourself with the same commitment you have shown up for everything and everyone else in your life. You are not past the point where your choices matter. You are precisely at the point where they matter most. If this video gave you something real today, please give it a like and share it with a man in your life who needs this conversation but has never had it. A brother, a friend, a father, someone who is quietly carrying symptoms he has never told anyone about. Give him the gift of this information. Subscribe if you have not already. Leave me a comment below and tell me, what is one thing from this video that you are going to do differently this week? I read every comment because this community of men taking their health seriously is exactly why I make these videos every single week. I am Dr. Hana Mori. Your prostate is worth protecting, and you are absolutely worth the effort it takes to do it right. I will see you next week.